So I'm Gurch Randhawa. I'm Professor of Diversity and Public Health at the University of Bedfordshire. I recently served on the Organ Donation Task Force. The task force was made up of a number of clinicians, transplant surgeons, government policymakers, and I was, if you like, the patient and donor family voice, because I've spent the last 17 years carrying out research into why there is such variation in terms of organ donation rates and transplant recipient rates. I think we need to remember that in this country, if you're from the Black or South Asian community, you're at least 3 times more likely to require a kidney transplant compared to the rest of the white population. And that's for 2 reasons. One is the demand is much higher because conditions like diabetes, high blood pressure, kidney disease are much more prevalent amongst those communities than others. And the other more important reason is there is far fewer donors coming forward from the Asian and Black communities. And what I've been doing is working with families and communities to understand why there's such a lack of donors. And there are 2 key issues. One is there is a genuine lack of awareness that people from particular communities need organs more so than others. So people genuinely don't realise that ethnic matching, because of tissue type and blood group matching, is so important, and it's so important therefore that all communities contribute to the organ donation pot. And also, I don't think people realise until you tell them that it's specifically urgent amongst the Asian and Black community, which is what you find from a patient's perspective in this country, is that on average a white patient waits about 2 years for a kidney transplant. If you're from the Black or Asian community, you wait on average 4 years. That's assuming you get a transplant. And just describing what it's like to wait for a transplant, for a kidney transplant, it's 3 to 4 hours a day, 4 to 5 times a week on dialysis. Now that impacts upon the quality of your life, your family life, your work life. And the only solution to that is to get a transplant. And what happens is when you talk to donor families is they say that, you know, when they've tragically lost someone, they find it very difficult then, unless they know what their loved one wanted in advance, to say yes. And what we're trying to do as a result of the work of the task force now is to make the conversation about organ donation a far more frequent, normal conversation to have. So we're working with faith communities, with educational establishments, to make sure that people have the opportunity to think about organ donation in their everyday life. And also for some people, faith is very important, so that we're working with faith leaders and faith communities to say, well, what do you think about organ donation? And the way we approach that is we treat it in a sort of a human way. We say, well, how would you respond if a patient or a family came to you and said, my kidney is failing, I have a choice. I either choose to stay on dialysis, which obviously impacts upon my quality of life, or I have a choice to join a waiting list for a transplant. If I join a waiting list, that means I'm going to have to wait for an organ donor. What would you advise? So we get people to think about how they'd feel about joining a waiting list and how they feel about transplantation first. Once we've got them to think about that and come to a view, we then say, well, how would you feel about you yourself being an organ donor? And also then making sure you debate that and discuss that with the people who you feel need to know, so that they are aware of your wishes, so that they, if they are obviously asked at a very tragic time, they make an informed decision. Because it's quite interesting in this country that 40% of white families, when approached in a hospital at that tragic time, say no, whereas 70% of non-white families say no. And all the research shows is that those families say it's because they didn't know what their loved one wanted, and they presume there must be a religious objection. We've worked with all of the faith leaders from all the different faith communities in the UK, and all of them are clear there isn't a religious objection, but they do recognise they probably haven't done as much work in communicating the whole issue about organ donation and the urgent need within their communities. A particular situation that's current, if you go to places like London or Birmingham or Manchester, where there are lots of ethnic communities, you will find there that over 50% of their waiting list for a kidney transplant is made up of Asian and African Caribbeans, whereas across the countries it's 25% of non-whites. And bearing in mind we only make up 8% of that population, that's quite worrying. But I was in a London hospital quite recently, and some people will think it's quite funny, but for me this is a reality. The dialysis unit in this hospital, which I won't name, was full of 20 beds. 19 of those 20 beds were Asian and black patients. The new bed, the 20th bed, was a new patient. He happened to be a white gentleman. And it was very interesting because I happened to be there that day. The other 19 happened to be men, were in quite a jovial mood and laughing away and saying to this guy, "Don't worry about it, mate, you're going to be okay." And I thought it was very interesting that that's how they're choosing to cope with their situation, because they now know, after years of being on dialysis, that gentleman, because of his ethnicity and knowing that 98% of donors happen to be white, is probably going to be on dialysis for a very short time. He'll get a transplant. Whereas those 19 gentlemen have been on dialysis for a number of years, and a lot of them are resigned to the fact they're not going to receive a transplant. And what they will tell you, as they tell me, is there's just too much ignorance, there's too much inertia amongst the Asian and black communities, and they are trying so hard to break down that ignorance and break down that inertia. And that's what those families will say to you, and the donor recipients will say to you. We need to break down the inertia, we need to break down the ignorance and mobilize the huge strengths in our communities of bonds to our advantage and get more donors coming forward. The most extreme issue that affects anybody waiting for a transplant is ultimately, if they don't get a transplant, it could result in their death. So we must remember that in this country, 1,000 people a year die waiting for a transplant. That equates to 3 people a day die. So today, 3 people will die because they didn't get a transplant. That's the extreme example of what it's like to be waiting for a transplant. Now, obviously, while you're waiting, that impacts upon your ability to work, it impacts upon your family life, but also emotionally and psychologically, you're having to wait for that phone to ring, and that impacts upon you. And because people know, because when they go to dialysis they see other people, they'll begin to appreciate that actually it's because of my ethnicity and blood type and tissue type I'm less likely to receive a transplant. So what you find in this country is you're getting a lot of people waiting for a transplant, and their friends and colleagues and family members, they're the ones who are ironically working with people like myself to mobilize the media, mobilize the communities to say, look, we need to do something about this, because this is a community problem and only the community can solve this problem. The NHS can't solve this, interestingly. You know, we as public society have got to come forward and got to engage with the organ donation. I think a lot of the fears that all the research has shown that I've carried out for donor families is they do not know what the body will look like once the organs are removed. Also, people genuinely don't know whether the burial or cremation will be delayed. They don't know whether the body will be decomposed in any way. All of these things are genuine concerns across the world. They're nothing unique to the UK, they're nothing unique to particular ethnic communities. And what we've done as a result of the work of the task force is now put together a tailored training program for organ donation nurses, so that when they approach a family, they help the family to understand these issues in a proactive way. So that what they'll do is they'll raise with the family all of these issues. They'll say something along the lines of, we understand that you might be concerned about the burial or cremation being delayed. Let us reassure you. We understand you might be concerned about what the body might look like, or what your faith says. Let us reassure you. And historically, because these issues haven't been surfaced by the professional, most families obviously have been too upset or too nervous to raise these issues, and sadly the families have said no. Whereas now what we're finding is once the family feels reassured, then they're more likely to say yes. But we need to train healthcare professionals to ask in a sensitive way and in an individual way for each family. But at the same time, we need to ensure that families ideally aren't thinking about this issue for the first time at the tragic time of losing a loved one. We need to find a way, like they do in Spain, of making organ donation a normal thing to talk about at your dinner table, at your school, at your place of work, in the media. So if you look at Spain, which is the most successful country in terms of organ donation and transplantation, their media frequently reports in a positive way about those people who've made that brave decision and say, one body saves 9 lives. That's a powerful message if you convey it properly in the media. So they've got that message out. They also cover those 9 lives that are saved and show what's happened and how those people's lives have benefited. We need to do the same in this country so that we're all routinely talking about this. We need to get priests, vicars, imams, everybody thinking about this issue so that they're all thinking about this in an informed way, in a measured way, so that if you and I want advice from someone, that person is well informed to give us proper, sensible advice.